Ever wondered why antihypertensive drugs are so essential in the healthcare field? Well, let's embark on a journey to understand this better. Hypertension or high blood pressure is a prevalent condition worldwide. It's a silent killer, often showing no early symptoms. Yet, if uncontrolled, it can lead to life-threatening consequences. Every year, millions of people globally are diagnosed with hypertension, and the numbers are on the rise. Hypertension can be likened to a river flowing with too much force, causing wear and tear on its banks. In the same way, high blood pressure exerts excessive force on the walls of our arteries, leading to damage over time. This damage can result in a multitude of health complications, including heart attack, stroke, and kidney disease. Enter antihypertensive drugs, the superheroes of this story. These medications are designed to lower blood pressure by relaxing blood vessels, reducing the volume of fluid in the body, or slowing down the heart rate. Imagine a bustling city with traffic flowing at breakneck speed. The city planners decide to implement measures to reduce the speed, like widening the roads or implementing speed limits. Similarly, antihypertensive drugs work in different ways to reduce the speed of blood flow, thus reducing the pressure on the arterial walls. By doing so, these drugs help in managing hypertension effectively, reducing the risk of complications. They give our bodies the much-needed respite and time to heal, thus preventing the onset of further damage. It's like turning down the volume on a loudspeaker that's been blaring at full blast for too long. In a nutshell, antihypertensive drugs are not just about lowering blood pressure. They're about giving the body a fighting chance to recuperate, about preventing the progression of damage, and about enhancing the quality of life for individuals living with hypertension. So, antihypertensive drugs play a substantial role in managing hypertension and preventing its complications. They are indeed essential tools in the arsenal of modern healthcare. Now, how do these antihypertensive drugs actually work? Well, sit back and let's delve into the fascinating world of antihypertensive pharmacology. These drugs are designed to lower blood pressure, and they do so by acting on several systems within our bodies. One major system they interact with is the renin-angiotensin-aldosterone system, often shortened to the RAAs. This system regulates blood pressure and fluid balance. When blood pressure is low, the kidneys release an enzyme called renin. Renin then triggers a cascade of events leading to the production of a hormone called angiotensin II. Angiotensin II has a couple of key roles. It constricts blood vessels to increase blood pressure, and it stimulates the release of aldosterone, a hormone that causes the kidneys to retain sodium and water. Antihypertensive drugs, such as ACE inhibitors and angiotensin II receptor blockers, interrupt this system, leading to relaxed blood vessels and decreased fluid volume, which in turn reduces blood pressure. Another system targeted by antihypertensive drugs is the sympathetic nervous system. This is part of what's called the autonomic nervous system, which controls involuntary actions like heart rate and blood pressure. Drugs like beta blockers work here, reducing the heart rate and the force of the heart's contractions. This means the heart doesn't have to work as hard and blood pressure decreases. Finally, some antihypertensive drugs act directly on the blood vessels themselves. These include calcium channel blockers and vasodilators. They work to relax and widen the blood vessels, making it easier for blood to flow through them. This reduces the resistance against which the heart has to pump, and hence lowers blood pressure. To sum it up, antihypertensive drugs target multiple systems to achieve their goal. They might reduce the production of hormones that constrict blood vessels, slow down the heart rate, or directly relax the blood vessels. In essence, these drugs work to relax and widen your blood vessels or decrease the volume of blood, helping to lower your blood pressure. Did you know that there are several types of antihypertensive drugs? Let's delve into them one by one. First off, we've got the diuretics. These are often called water pills. They work by helping your kidneys expel more salt and water from your body. When you flush out more salt and water, your blood vessels can carry less fluid, leading to lower blood pressure. Simple, isn't it? Next up are the beta blockers. These drugs slow down your heart rate and decrease its workload, which in turn lowers your blood pressure. They work like a charm by blocking the effects of the hormone epinephrine, also known as adrenaline. Then we have the ACE inhibitors, which stands for angiotensin converting enzyme inhibitors. These drugs help relax your blood vessels by blocking the formation of a natural body chemical called angiotensin II. As a result, your blood vessels don't narrow, and your blood pressure stays in check. Calcium channel blockers are another type of antihypertensive drugs. They prevent calcium from entering the cells of your heart and arteries. This action relaxes the blood vessels and your blood pressure goes down. Last but not least, we have the angiotensin II receptor blockers, often abbreviated as ARBs. These drugs block the action of angiotensin II, allowing blood vessels to widen or relax. This widens your blood vessels and reduces the amount of fluid in your blood vessels, leading to a reduction in blood pressure. So there you have it. The world of antihypertensive drugs is wide and varied, each with its unique mechanism of action. From flushing out excess fluid to blocking hormones and preventing calcium from entering cells, these drugs employ a range of tactics to keep your blood pressure in check. Each type of antihypertensive drug works in a unique way to help lower blood pressure. So next time you hear about these drugs, you'll know exactly how they're helping to keep your heart and your health on track. While these drugs are beneficial, they can also have side effects and interactions. Let's delve into the potential side effects of antihypertensive drugs. They can range from mild to severe, and they differ depending on the type of medication used. Some of the most common side effects include dizziness, fatigue, headaches, and occasional bouts of nausea. In some cases, patients may also experience more severe reactions such as irregular heart rhythms, shortness of breath, or even depression. It's important to remember that these side effects are not a certainty, but a possibility. The key is to recognize them early and communicate openly with your healthcare professional. They are equipped with the knowledge and the tools to help manage these side effects effectively. Now let's switch gears and talk about potential drug interactions. Antihypertensive drugs can interact with other medications, supplements, or even certain foods, altering the way the drug works or increasing the risk of side effects. For instance, non-steroidal anti-inflammatory drugs, or NSAIDs, can decrease the effectiveness of some antihypertensive drugs. Certain types of antidepressants and cold medications can also increase blood pressure. Even foods can play a role. For instance, a high-sodium diet can counteract the effects of some antihypertensive drugs, making them less effective. On the other hand, grapefruit and grapefruit juice can interact with certain blood pressure medications, potentially leading to dangerous side effects. But don't let this information intimidate you. It's not about avoiding these interactions altogether, but about managing them. And that's where your healthcare professional comes in. They can guide you on how to navigate these potential interactions, advising you on what to avoid, what to monitor, and how to adjust your lifestyle accordingly. Remember, antihypertensive drugs are not a one-size-fits-all solution. They require careful management, open communication, and a bit of trial and error. But when used correctly, they can help manage hypertension effectively. Despite potential side effects and interactions, when managed correctly, these drugs can greatly improve the quality of life for those with hypertension. So, what have we learned about antihypertensive drugs today? Well, let's take a moment to go back and refresh our memories. We started off by underlining the significance of these drugs. They're not just any medications, they are the lifeline for millions of people struggling with hypertension. This condition, often referred to as the silent killer, can lead to serious health complications like heart disease and stroke if left untreated. Then we dove into the fascinating world of antihypertensive pharmacology. It's a vast and complex field, but to simplify, these drugs work in different ways to reduce high blood pressure. Some relax and widen your blood vessels, making it easier for blood to flow. Others slow down your heart so it doesn't pump as hard. And then there are those that decrease the volume of blood so there's less to pump in the first place. We also talked about the different types of antihypertensive drugs. Remember the 5 main groups? They are diuretics, beta blockers, ACC inhibitors, angiotensin II receptor blockers, and calcium channel blockers. Each of these types has a unique mechanism of action that targets a specific aspect of the blood pressure regulation process. And of course, we couldn't leave out the potential side effects and interactions. Like any medication, antihypertensive drugs come with their own set of possible side effects, ranging from dizziness and fatigue to more severe ones like kidney damage. It's also crucial to know how these drugs interact with other medications and substances to prevent any adverse effects. So there we have it. A quick journey through the world of antihypertensive drugs. They are not just pills to be taken lightly. They require a deep understanding of their pharmacological properties, types, potential side effects, and interactions. With the right knowledge and management, antihypertensive drugs can be a powerful tool in combating hypertension and its complications.